Research Solutions. And before we begin the presentation, I'm going to take a brief moment to cover a few of the tools that we have available for you today. So first is the feedback box, which is located directly above the chat box. I'm going to go ahead and open it now. So our first question, so that we know that all of you know how to use this. First of all, does your campus use any depression screening tools? And go ahead and answer yes or no or blank if you do not. Or no. And that will be in the feedback box, which is right above the chat box. All right, so looks like we have a majority with some yeses. All right, so for those who've already responded, you will see the chat box, which is right below the feedback. And so if you answered yes, go ahead and type in which tools your campus uses.
On the right page. No, the downloads is right here. It's on this thing.
Okay. Looks like Sylvia, one of our speakers, has typed in her tools. Megan, anyone else that would like to share the screening tools that your campus uses, go ahead and type it in the chat box. This will be really helpful for our presenters to get an idea of the detailed information on the tools that they're presenting. All right, thanks Lisa for the feedback. So we'll go on to the next reminder. Everyone should have received a link to the PowerPoint slides and handouts for today's session. It went out about 45 minutes prior to the session. There's a link called Content Link within that email that allows you to access those items. Today's webinar is also being recorded, and it will be archived on the CCC SMHP website for future access. And that usually takes us about a week to put up there. All right, so at this point, we are now going to take a moment to record and mute all of the phone lines. Once muted, if you have questions, you can go ahead and press *6 on your phone's keypad to unmute or remute yourself. If you do have questions, you can also use the chat box, which we will be moderating today. All right, with that said, I'm going to go ahead and begin recording and mute all the lines. I hope this will work. All right, so with that, I am going to hand off the floor to our speakers today. We have Sylvia Warden from Orange Coast Consortia, Julia Little with San Diego City College, and Elaine Akers from San Bernardino Valley College. Sylvia?
Can you hear me?
Yes, we can.
Okay.
Go ahead, Sylvia.
Sorry about that. I thought I was muted, but I was wrong. Okay. Thank you so much for your attention. I'm going to be presenting basically our latest regional strategizing forum presented by the Orange Consortia, which was the grant group between Golden West College and Orange Coast College. So a lot of the material I'm presenting is actually from Orange Coast College Student Health Services. Christine Kleinpeter is one of the social work professors at CSU Long Beach and is also kind of the main clinical psychologist of Golden West College. Rob Bachman, of course, is the director over there. Ron Wilson of Orange County Healthcare Agency is a registered nurse, retired Army major, and finishing up MFT intern with Orange County Healthcare Agency. and he works on our campus with student veterans. I'm the Associate Dean of Student Health Services here at Orange Coast College. And so this was presented at our March 14th Regional Strategizing Forum. Anyway, the OCC and Orange County Healthcare Agency Drop Zone is a collaboration between us and the County Healthcare Agency, or Health Department is what other counties would call it. And they actually provide a mental health professional here on our campus to work with student veterans. Orange Coast College provides an office, phone, computer, locked file cabinet, and we also give him an internet account, email, and parking pass, just like an employee here. So then we have him on campus at least 12 hours a week. His salary, supervision, and all that is taken care of by the healthcare agency. And then he is a direct conduit into the county mental health system for our veteran students, and also able to make other referrals for student veterans. I should add as well that any veteran who's a college student is eligible to come and see Ron here. It's not exclusive to Orange Coast College. So anyway, this is a Cal Mesa Prevention and Early Intervention program on the part of the Orange County Healthcare Agency. The focus is on support and referral to resources. It is not mental health treatment per se. So over the past year, Ron Wilson has used the PH2-9 and other assessment tools in order to assess and look at progress with his veterans who he's seeing over time. He's now moving to a different tool called the Personal Growth Initiative Scale, which is PGIS-2, and that is much more of a, or much less of a mental health scale than looking at attitude. However, it is also strongly related to psychological well-being, negatively related to psychological distress. So it's kind of a proxy for depression. What we're planning at this time is that Orange Coast College is going to use the PGIS-2 with our mental health group, so that we'll have a comparison group of our student veterans versus our regular mental health population. And then now I'm moving over to Golden West College, and Dr. Kleinpeter has a whole research program that she has in place that I am going to very briefly describe to you. Anyway, she started a couple years ago with a baseline audit of the mental health files at Golden West College. And so what she found at the time was she was looking for diagnosis, goals, evidence of active intervention, evidence of measured response to treatment, and case disposition. So she found a lack of consistent documentation at the time and a dropout rate of 44%. So the first response was administrative, establishing uniform charting expectations for everyone, including nurses who were doing intake and the mental health therapists. Case disposition follow-up calls, which means calling after no-shows. And then the nurses were trained in motivational interviewing, as were the other mental health therapists who were not familiar with that. And the front desk began to make reminder calls for all appointments. So basically the purpose was, very simple. Describe who they're treating, what kind of treatment they're receiving, compare the students in the health center to the general population to make sure that, diversity is being served, and to look at prior years and have a data set for, for looking comparison in the future. And Dr. Kleinpeter was also studying the relationship between therapeutic bond and treatment progress. So anyway, at the time she found that the typical mental health student received about 4 sessions The range was 0 to 11, with 0 meaning that they quit after a nurse intake only. And depression is the largest single diagnosis that they're seeing. 6.9% are dropping out after the nurse intake and almost 20% after one session. So they did have strong therapeutic bonds reported with their counselors, which did show higher levels of treatment progress. Anyway, they did another audit the following year, and they found out that their drop rate had really decreased significantly, down to 25%. They were finding that the charts contained diagnosis, goals, treatment plans, and interventions. And interventions of evidence-based practice were clearly documented. Outcomes were measured, as far as goals met, partially met, or not met, and they were using a symptom checklist. They served more clients than the previous year, a total of 146, and in comparison, Golden West, Orange Coast College saw over 350 individual students for mental health this year. Anyway, just a simple audit provides important information about your mental health services, and your staff can receive some feedback that leads to improved care. Of course, students benefit and the program benefits overall. And Dr. Klein-Peter recommends useful research questions, use practical instruments and surveys, and do research that is going to improve your services. Hit the wrong thing there. So your first steps are go ahead and do your baseline audit. Just your number of students seen per year, demographics, therapy sessions per client, dropout rate, and your number of service hours. And so, then you're able to compare your data to other years. You're able to compare your data to other colleges if you're using the same or similar instruments. Using standardized instruments means that they're already valid and reliable, and they're measuring what you want them to measure. Client checklists such as the PHQ-9 or other are easy because the students can complete them while they're sitting there waiting for their appointment. So next year, Dr. Klein-Peter is going to add the PHQ-9 into the mental health and the regular health center clients. And we are inviting everyone who would like to participate to give the PHQ-9 to their students as well who use the Student Health Center. If you would like to participate, you're welcome to contact me during the summer. Dr. Klein-Peter will be around in the fall. And CSU Long Beach is willing to analyze our data and give us data sets back. And that's my presentation. Any questions?
Okay, thank you, Sylvia. And before we move on to the next presenter, did anyone have questions? Okay. If you do think of any, you can always type them in the chat box, or we can address them later in the webinar. So I'd like to introduce Julie Little. She's with San Diego City College. Julie?
Hi, can you guys hear me?
Yes.
Oh,
Yes.
good. Okay. So I'm going to talk a little bit about the depression screening tools that we use at City College. I'm trying to make the presentation skip to the next slide. Oh, there we go. Okay. So the first one I wanted to talk about is the interactive screening program, which we purchased from the American Foundation for Suicide Prevention. And the reason we chose this tool, it allows students to go online and complete an anonymous assessment, but then they also can dialogue with a counselor, basically through email after they finish the assessment. And so it was a little bit more than just a screening, but it was still something that they can do from home. So we really liked it for that. And then also it's listed on the SBRC's Best Practices Registry. And the other reason we picked it is because we needed it very little from our IT department to get it set up and running. Basically, we just picked a domain name, and AFSP sets up and kind of provides the technical support for the site. So all we had to get from our IT department was a dedicated email address for the responses to go to. As far as cost goes, you can see on here, the first year is $5,000, and then it's $2,500 for each additional year. We were able to purchase it with our Cal Mesa grant money. But I know AFSP is really willing to work with colleges on the cost to bring that cost down. For us, they did we paid for 3 years up front, and then they fronted the next 3 years for us. So they're very workable as far as cost goes.
Okay, Leo.
Somebody doesn't have their phone muted. So basically, here's how it works. Students can go to the website that AFSP set up. So for us, we picked citymhp.org. Or students can scan a QR code with their phone, which kind of takes them to a mobile version of it. So there's a really great mobile version of the assessment, as well as
Julie, let me interrupt for just a second.
Yeah, no problem.
That might be one of our speakers. So if everyone could press *6 on their phone, it will mute you, except for you, Julie.
Okay.
All right. Thank you, everyone.
Okay, I think we're good. So once the student goes onto the website, they kind of self-select a user ID, which they can type in anything they want. They can put, I love dogs or whatever, to keep it anonymous. Obviously, at the point at which they set up an appointment, it would become non-anonymous. But in the beginning, they select their user ID, and then they fill out a questionnaire, which I'll show you in a few minutes. And then the responses will go to that dedicated email address that I mentioned. We have a specific counselor set up each day to check. So in our office, we use a lot of interns. We have 3 staff counselors as well as interns. So it works out well for us that we have one who checks it each day, and then that person will respond to the questionnaire, and then they're responsible for the follow-up with that student. So the person who checks it each day just takes the new surveys that have been filled out. I hope that makes sense. For us, it's about 3 to 4 hours of clinical time each week, and we really do kind of market it strategically. So in the beginning of the semester, we'll push it a lot, and then if it gets to be kind of too much, like if we can't handle all of the responses, we'll kind of cut back on how much we market it. And basically the way that we market it through flyers and classroom presentations. We have a group of peer educators that work for our mental health counseling office, and so they host a table every day in the quad. And so when they're talking with students at the table, it's really great for them because they can have something kind of tangible to give to the student. So if they're talking with a student who's struggling, they can hand them the flyer, and they can either go online and fill out the assessment right there using their phone, or they can go home and do it. But like I said, if it gets to be too much, we'll kind of ask the peers not to promote it at the tables. And then we also, our peers do classroom presentations each semester. So like this last spring, our peers did about 50 classroom presentations where they just go in and give like a 5 to 10 minute presentation on mental health and suicide prevention. And they can talk about it there as well. And we've actually had a lot of really good feedback from instructors who really liked having something tangible that they can give to students who are struggling. So we usually give instructors stacks of flyers at the beginning of each semester in their boxes so that they can just have the stack of flyers with them in their classrooms and hand them out if needed. Let me show you guys. This is just the flyer that we use. So it's just a basic telling students about it, and then you can see that QR code at the bottom and the website that they would go to if they want to fill it out. But I really can't say enough good things about AFSP. They provide really good support for it. We've been using it for about a year and a half, and we've only had, I'd say, one problem student, a student making threats through the email, and just obviously kind of wanted a rise out of our counselors, I guess, for lack of a better word. But they really kind of coached us through it and helped us with how to respond to that student. And they'll watch too. The way that the responses come in to our email is the surveys are flagged like Tier 1, Tier 2, Tier 3. And so if it's a Tier 1, which is the most severe, we try to respond that same day. And then Tier 2 and Tier 3, I think it's like 36 to 48 hours that we respond. But again, AFSP is really great. If they notice on there that we have responses that are pending, they'll email us or contact us to make sure that we're going to respond. And then the site is also really great. When we have school breaks, it will flag at the top, that the mental health counseling center is closed and that they can't access the survey during our breaks. And it also says on there that they won't receive responses over the weekends. So for us, it's worked out really well as far as managing it and as far as, it makes us nervous with liability issues and things like that. But so far, it's been really great. And we've had a lot of students come in after taking the survey and making an appointment. And our counselors, when they respond, they're really careful not to do actual treatment or therapy through the email. It's mostly just kind of going over their assessment with them, noticing specific things. I'll click here to show you. Right here is what you're looking at is what you would see if you went on the website right now, because we're closed for break. So right now nobody can take the assessment. So this is like the flag that goes across the top, and then there's community resources below for people. And then this is just a screenshot of somebody's assessment, and it asks how the student's been feeling within the last 4 weeks or so. But it's really great because the counselor who responds can go on and see what specifically the student might have been struggling with and kind of tailor the response. And colleges can choose to have a template response, or they can just kind of make it personal. And for what's worked out for us is we've just had the counselor respond with a personal message each time. That seems a little bit easier for us than cutting and pasting a template and then trying to tailor it on the back end. I'm looking at these questions down here in the chat. I'm wondering if SDCC provides the counselor who responds by the email. Oh, it is our counselors at SDCC. It's not AFSP. And then as far as users per month, I would say, I probably should have checked that beforehand, maybe 20, 25. There's mornings we'll come in and there'll be 3 or 4, maybe 5 responses, and there's mornings where there's none. So, and like I said, I know that we would get a lot more if we promoted it a lot more, but that's kind of all that our counselors can manage right now. So we just kind of promoted enough. If we ever have more counselors or more office space, we could definitely promote it a lot more, I think. And then this Michelle asked, is the counselor responding is the person responding a counselor or a therapist? We have, in our office, we have 3 actual college faculty who are LCSWs, and then we use MSW interns and MFT interns as well that provide our counseling. And so all of them share the responses. Hope that makes sense. So if there's no more questions on the ISP, I'll move on to the next thing that we do, which is for National Depression Screening Day. We usually purchase the in-person kit from mentalhealthscreening.org. I don't know if you guys have used that before, but it's pretty cost-effective. It's $215, and you get 100 surveys or assessments, and then a lot of other marketing material and things to promote National Depression Screening Day. And then for, I think it's like $30 or $40, you can get extra screening forms. So that $215 covers 100, and then we usually order a couple extra packets of the screening forms each year. And the tool that they use, they call it the Mood and Anxiety Disorders Screening Form. We really like it because it takes probably 10 to 15 minutes to fill out. I'll click down and show you guys the form really quick because it's in this. This is the form. The top that top little section, screens for depression, and then below that is bipolar, and then on the next page is anxiety, and below that is PTSD. So it does more than just screen for depression. And so usually for National Depression Screening Day, we either have just our counselors out in the quad, or we have a whole resource fair. On different years, we've done different things. But as far as what we do is we set up a table with all of our staff there. So we have usually 6, 7, 8 counselors out there, and we offer incentives for students to fill out the form. So for us, we have this big prize wheel, which I'll show you a picture of it on this next slide. That prize table, you would not believe how many people will come up to your table if you're offering prizes. So it attracts a lot of attention. And usually we have, what we do is we tell students, if you fill out this form, you'll spin the wheel and get an instant prize. And the instant prizes are small things like Each Mind Matters merchandise. We usually buy a lot of that. Or just because we usually have 100 to 200 students fill out the survey, so we need 100 prizes. We buy like highlighters or healthy snacks, things that are inexpensive. And then we'll have a few bigger things like T-shirts and mugs or water bottles. And then in addition to getting their instant prize, they also are entered into a raffle for a larger prize. And for the larger prize, we usually give out a gift card to the bookstore, or a few times we've done given out Kindle Fires as the large prize. So that's what kind of gets students over and filling out the form. And like I said, it usually takes them 10 to 15 minutes. And after they're done, they'll come back and kind of meet with the counselor on the spot to score the form, and the counselor can kind of talk about it with them right there. Usually they'll kind of walk away from the table or find a spot in the shade if it does look like the person is struggling a lot. And then the student can either set up an appointment right there if they want to, or if they're not interested in counseling, we can provide them with community resources or at least the Access and Crisis Line. And for those who fill it out who don't show any signs of depression or any other mental illness, it's still a really great opportunity for our counselors to kind of talk about the warning signs of suicide, or talk about what symptoms to watch for in their friends and family, or what to do if they're ever struggling. So it's kind of been, we've always really enjoyed it. It's a great day to kind of get a lot of education out there as well as screen students. A lot of dialogue and things like that. So for us, that's been really effective. And we usually use those forms not only for National Depression Screening Day, but we'll use it at our Suicide Prevention Awareness Fair, and we also have a big health fair in the spring. So we'll do it 3 or 4 times a year where we do this same kind of thing. And then, like I said, we have usually 100 or a little over 100 students who will fill it out and get their prize. So it's a great way to reach a lot of students. Are there any questions on that one? I want to make sure I look at all of I see there's a question here on ISP. Are there questions about suicidal ideation and how is this handled? Yeah, there definitely are. And so if somebody does check yes that they've had thoughts of suicide, those are the ones that get flagged as Tier 1, and those come into the email box differently than the others. So there's a urgent message on it. So we try to respond to those right away. So hopefully that answers your question on that. So the last thing that we offer is the PHQ-9, and that's the assessment that we do with all clients who come into the office. So we do that at intake, and I'm sure many of you guys are familiar with the assessment. We use it because it's really short. There's 9 questions, and the 9 questions correspond with the 9 diagnostic criteria for major depressive disorder, and because it's one of the ones that's evidence-based. So that's why we choose to use it, and it's free, so that's nice. We always administer it right at intake, and then also again at their 4th session, and then again at termination, just to kind of gauge a client's progress. Obviously, if they come in and depression isn't what they're working on, we don't re-administer it, but if they are, because that is the most common thing that we treat in our center, then we re-administer it throughout their progress with us. And then there's a link there for the PHQ-9 if anybody's interested in that, and I think it's provided on the handouts for the webinar too. But that's all I have. Does anybody have any questions? I see here, on average, how long does it take a counselor to respond to each individual questionnaire? I think that's referring to the ISP. I would say 10 minutes or so to shoot off the email. To respond, we make sure we read through their whole questionnaire and then send a response that kind of shows, gives them feedback on what they seem to be struggling with, and then provides recommendations for either counseling or care in the community or things like that. So if there's no other questions, that's it for me.
All right, thank you, Julie. And
no problem.
If anyone does think of questions or have comments that they'd like to share with the group, go ahead and just type them in the chat as you think of them. And so our next speaker is Elaine Akers from San Bernardino Valley College. And I would just like to let everyone know we have a video to show. Depending on the technology that you're using, you hopefully can access it. If you're not able to access it during the webinar, we did provide the links for you to view on your own. So Elaine, did you, do you want to get started?
Hi, everybody.
There you go.
Can you hear me okay? Are you able to hear me?
Yes.
Okay.
Yes,
Great.
we can hear you.
Sure. All right. So, great information so far. And I wanted to share with you kind of a brief screening tool that we're using, and it comes out of the same larger tool that the PHQ-9 comes out of. I don't know if you're aware, but the Physician Health Questionnaire encompasses the PHQ-9, the GAD-7, and several other tools that were designed for physicians to screen their clients so they pick up on mental health disorders and other things that don't normally come up in an assessment. So in our clinic, what we've been doing is we've been using the PHQ-4 to screen everybody who comes into the clinic for triage, for an appointment with the nurse practitioner, or just to ask questions and get over-the-counter medication. And it's been really helpful to us to pick up on students that we normally would have missed who are struggling with anxiety or depression, because it's not always really obvious. And we know, a couple things that we know is that depression, of course, is a risk factor for suicide, and that 50 to 70%, depending on which study you read, of individuals that complete suicide were seen by a healthcare provider within the 30 days prior to that event and were missed. And so that's why we want to screen everybody that comes in. And the other thing that we really discovered as we were doing our lit review was that depression and anxiety occur a lot together in college students especially. And depression, of course, increases risk for suicide, but it also relates to poor grades. And anxiety often can decrease functional abilities, and the two of them together really put students at risk for not persisting, for dropping out, and not completing. So the PHQ-9 screens for both anxiety and depression. It's the first two questions of the PHQ-9 and the first two questions from the GAD-7. And if we have a student who screens positive, then we have them complete the PHQ-9 or the GAD-7 and then go from there as far as referring and taking care of their needs. So it's really been helpful to us. Additional screening tools, of course, as I just said, are the PHQ-9 and the GAD-7 for depression and anxiety. And then we also have a self-care plan that we utilize with students who may not want to go into counseling, may not want to start medication, or they just mildly have an issue that they need to work on, and this just gives them a plan for how they can take care of themselves and improve their ability to manage their anxiety or their stress that's causing them some depression. We also use the PHQ-9 and the GAD-7s to reevaluate students as they're treated to gauge their response to treatment. And when they're doing their intake for counseling, they do the PHQ-9, the GAD-7, and then an inventory of symptoms for their intake. And then, like was already mentioned earlier, if they're being seen for anxiety or depression, they're rescreened at 4 weeks and at discharge for those things. So we found the PHQ-4 is really valuable for doing screenings on the campus too, and so it's just really been helpful to us. One of the things I wanted to talk about is something I'm really passionate about is primary prevention, and some tools that we've used for that on our campus. And so we already talked about that students are high risk for suicide, and one of the things that we've really discovered and observed in our student population is that an underdeveloped identity can often increase their suicide risk and their risk for other mental health disorders as well. And this slide just kind of highlights some of the things that you might see easily thrown into crisis. So those students that you see every other day coming into your campus office in crisis, moodiness, mood swings, high anxiety levels, high levels of depression. So we were looking for a tool to help us address that underdeveloped identity. And our purpose, of course, for the grant was to decrease their risk for suicide. So we chose to use the strength-based intervention, the Clifton Strength Finder tool. Some of you have already heard about that, but it was developed by Gallup. It's a tool that was developed extensively through international research as well as research within the United States. And it utilizes an online assessment that takes about 30 minutes for an individual student to complete, and then they find out what their top 5 themes or talents are. And then those themes and talents can be developed into strengths with intentional effort. So we offered this through a 6-week interactive small group, and that small group just focused on how to build your talents and themes into strengths, and learning about some of the talents and themes that other people within the group had, and appreciating those and understanding how those add to our diversity and the richness of our campus. And it just kind of helps students see how other individuals in the group might be approaching things a little bit differently because of their unique talents and themes. One of the things we liked about strengths is that it can be very widely applied. So it's helpful in our goal, which was decreasing their risk for suicide, but it also is applicable to their increased ability to succeed. So some of the outcomes we saw, we used the GAD-7 and the PHQ-9, and we saw decreased depression and anxiety scores for those individuals that participated. However, they didn't necessarily start depressed or anxious, so keep that in mind. We saw increased hope through the hope scale that we used, increased self-esteem. They reported that they felt more confident. They had a better sense of direction because they had a sense of what environments might be good for them to function within, where they felt energized and where they felt, fulfilled. And they had an increased understanding of self. I include a couple slides here that just give you the questionnaire information and the scale information that we use in case you're interested in that, and some resources if you want to get a little more information about the strength-based approach. And we also included a PDF document, the Strength Quest Guidebook. That just gives you kind of a sense of how strengths are being used at other colleges. Not only for suicide prevention, which is what our goal was, but also just to support students in their academic success and their thriving in college. We did this video just so that you could kind of hear from students how they saw the benefit of strengths, and I don't know if it's going to work or not, so we'll give it a try.
Thanks, Elaine. So what I will do, everyone, is I will bring up the video, and you will have to press play and turn on your speakers. It's about 2 minutes. Once you have completed watching the video, go ahead and click yes under the feedback tool. All right, so give us just a second.
Knowing my strengths also does help me try to keep myself better. Knowing that I have these talents, that I have these strengths, kind of.
All guests have been muted. You can unmute your line by pressing *6.
Okay, this is Amy. So sometimes videos are a little difficult on our system. The video is accessible using a hyperlink in the PDF that you received. So Elaine, if we want to go ahead and continue.
All right, I'm back. Well, we tried, right? It's kind of fun. I saw there was a couple questions. One was about the cost of the Clifton Strength Finder assessment. It costs about $10 a student to do that. So with the grant, of course, we were able to pay for it through the grant. We budget some money in our student health budget for that next year for students that we're going to provide that to. And we have done it in classroom settings, and then it's like one of the things that the students buy, like a textbook or that sort of thing. We found that it's not as helpful in a classroom setting because you don't get that interaction that you get in a small group, and so, you know, it's helpful certainly, but the small group approach, I think, is the most effective for that. Some of the things that we really like about it is that it really celebrates the diversity of our students. It doesn't have any stigma attached to it, so our students are willing to participate in that intervention who might not do counseling, and often because of the success of the small group, and it might come out that they need some counseling, then they're willing to move into that counseling relationship because they've established a connection with us and feel safe. And so it's been really useful in that way too. Usually 1 or 2 students from every group end up entering into the counseling relationship with us as well. So one of the neat things, and I'm going to just talk about it very, very briefly because we're out of time, is that My staff, of course, took the strengths assessments because we're offering this intervention, and they understand their own strengths, and they've utilized their strengths to develop some interventions for our students. And for our staff, one of the things that we realized is we need to take care of our faculty and staff because they're on the front lines. They're dealing with the students that are troubled. They're the ones who refer to us. And so we wanted to offer them an event called Stress Solutions Oasis, and it was just to help them manage their stress, develop some skills in mindfulness. And that was developed by my marriage and family counselor, who has individualization, activator, positivity, developer, and connectedness as his strengths. And he loves doing this event. He gets to use all of his strengths doing this event. And we really found that because we repeated it every month during the grant, it became part of the college campus and the community, and now they don't want to let go of it. So we're going to continue to do it. We won't be able to do it as often as we were able to do it with the grant. Because we don't have the funds for that. And we have to find funds that aren't student fee funds, since it's something that we're offering to faculty and staff. But it was really valuable. It created some real connections, and it helped raise awareness about mental health issues and made us personal so that they're more comfortable referring to us. Another event that came out of the strengths of my staff, I have a couple staff who have WOO. WOO are people who don't have any strangers. They love to be in front of a crowd, and that's not me, but that's some of my staff. And they love communication, and they're maximizers. So they developed this blue carpet event, which is modeled after the red carpet at the Academy Awards, but we have blue because that's our school colors. And we just help students celebrate their successes. And that got really institutionalized, too, on our campus, and a lot of other student groups are starting to do it on their own, borrowing our Easy Up to do it. We did it at graduation and graduation breakfast, and it's just something that really creates a lot of positive emotion on campus and connection and community. So we really enjoy doing it. And that's all I have because we're out of time.
Thanks, Elaine. We did have a question from Julie. How do you recruit students to participate in the small groups?
Well, we do a number of things. We send out flyers to their emails so they know that those are going on. Word of mouth is a really strong recruiter on our campus, so students who have participated in the small groups before bring their friends or let their friends know. When we have students come into the Student Health Center who we see that it's something that would really be helpful to them, we let them know personally and invite them personally to come to the groups. And then we do a lot of classroom presentations, not just about strengths. We go and just talk about student health services and all the services that we can provide to them, but we let them know about the strengths group at those. And sometimes we'll do just an hour workshop on success, and at the end of that workshop we give them the opportunity to sign up for a strengths small group, because that really is consistent with being successful and setting measurable goals and those kinds of things. So those are some of the things that we've done to promote that. Any other questions?
Okay, well, if anyone thinks of any, you can always email us, and we'll forward it to the presenters. I do want to thank everyone for participating today, and a big thank you to Sylvia, Julie, and Elaine for presenting and sharing what works on their campus with the depression screening tools. As you begin to log off and close out, there will be a short evaluation form that will pop up on your computer screen. We would really appreciate it if you took a moment to complete it and provide us with your feedback so that we are able to improve these sessions in the future. Again, thanks for joining us and have a great afternoon.